Hi, welcome to Surgical Scrubology. My name is Damon. I'm a certified surgical technologist, and today's video, the surgical scrub. This video is going to be the first in a series of videos labeled Back to Basics. And the foundation that I'm going to start with is basically the bare bones of what it is that we do. Surgical scrubs, aseptic technique, sterility, instrumentation, passing instruments, positioning, draping, OR etiquette, those sort of things. So in order to go into the more advanced practice, I decided that I'm going to start with some foundational things first. Okay, now that that's out the way, let's cue the intro. This is your basic scrub sink. You have your antimicrobial liquid soap. You have your two types of scrub brushes. One is the iodine-based scrub, and this is the chlorhexidine-based scrub. Both of these are effective scrubs when you're talking about performing a surgical scrub. There's a third option, which is a gel solution with active ingredients, alcohol, and chlorhexidine. Now what I like to do is that I like to make sure to have all rings, all jewelry, watches, those sort of things off. I have my hat. Let me grab my mask. So I have my mask ready to go. And before anyone should scrub, you should go ahead and open up your canvas bag. Okay, now we're going to perform our surgical scrub. I'm going to start by turning on my water. We also have here our antimicrobial soap. So we're first going to wash our hands with that. All right. With my arms, hands. Alright, at this point I'm going to just start to lather things up. You want to make sure you get a nice coverage over your hands, between your fingers. Kind of go across my palms with my nails, make sure I get the soap under my nails. I'm down my forearms to my elbow area. Do the same thing with the other arm. Although it's not necessary, this is a good moment where you want to kind of practice keeping your hands in the up position so that your elbow is lower than the tips of your fingers. It's not necessary for the stage, but it's important technique when you start your actual surgical scrub. So now that I see that I'm nice and lathered up, I'm going to go ahead and rinse. All right. Rinsing. Using the same technique if I was going to surgical scrub. Again, it's not necessary, but it's good practice. Move around. My elbow is still lower than my fingers, as you can see. All right, now cut all that off. Get a paper towel so I can dry my hands really quick so I can demonstrate the next step. Okay. Again, you have two types of scrub brushes before you in most facilities. You have the 4% CHG or chlorhexidine scrub brush, and you have your iodine-based scrub brush. Again, they're both pretty effective for lowering the resident microbials on your skin and your hands, or your forearm and your hands. So it just kind of comes down to preference. So I'm going to take the CH3. All right. I found that it's really, or it can be extremely difficult to open this packaging when your hand is wet. So it's a good idea to open this packaging before you start to get your hands wet. Inside the packaging, again, there's a brush, there's a bristle, and it comes with a nail pick. All right. For those who don't know, if you hold your hands up and you can see your nails over your finger, that's probably a good indicator that you probably should use this nail pick. I use it anyway just for good measure to be sure that I perform my scrub properly. So let's turn on the water here. Let's get started. All right, what I like to do is I like to go ahead and with the brush, kind of lather it up a little bit, get that soap going, and then I take the nail pick, and I just go through all my nails. You know, it doesn't matter whether you start with your thumb, your pinky, your middle finger, whatever. Just as long as that you go through all of them. All right. That done. Do the same thing for the other side. And some facilities have some, like these nail picks in like a little container where you can get that out and use it like when you're actually just washing your hands with the antimicrobial liquid, you know, hand soap. So you can take that time to do it too as well. Okay, now that I got everything picked, I'm gonna take my pick, toss it in the trash, and lather this up some more. I'm gonna wet both my arms and get that started. Again, holding my arm in a fashion where my fingers are higher than my elbow. And I'm leaning into the sink and I'm letting the water go from the tip of my fingers to the end of my elbow. I'm pulling my arm out, bringing it back around and starting again. What you want to avoid is this action because you want everything to run from clean to dirty, right? The dirty meaning off the back end of your elbow. But if you're rocking it, it goes from clean to dirty back down to clean. And that's what you want to avoid. So I'm going to bring that through. I'm going to bring this through again. Get this nice and saturated. So I like to lather up first. Turn my water off because I just hate to hear the sound of running water for some reason. And I start with scrubbing my nails on the bristle side. Get that lather in, okay? Now, you can use this bristle or you can use the sponge side. I tend to use the sponge side because it's a little bit more gentler on my hands. So, or on my skin, so to speak. All right, so, all right. Each scrub is like 2 to 5 minutes, or like 2 to 3 minutes, should I say, per arm. I tell most students or people who are kind of orientate on scrubbing to do about 10 strokes per side. What we like to do is scrub in 4 planes, so there's 4 sides of the fingers, hands, and arms that we want to get. So there's one side, the second side, third side, and the fourth side. And you kind of want to just slide over to the next finger, do the same thing. Side, 2, 3, and this is 4. 1, 2, 3, 4. Okay. Then I'll go from this part and I'll drop down to my palm area. I'm doing the side. 1, 2, 3, 4. Now, if you're starting from this area again, it doesn't matter if you go this way or this way first, as long as you're hitting all 4 sides, okay? So 1, there's 2, there's 3, and there's 4. And from this point, you want to drop down to your upper forearm or your wrist area, 4 sides. 1, this is 2, 3, and 4. And then you want to bring it down to your elbow. 1, 2, 3, and 4. All right, once that's done, I turn back on my water, get some more suds on this, and then I proceed to do my right arm with the same technique, starting with my nails. Nails on the bristle. Okay. I start at my thumb. Generally, you start at your thumb and not your pinky, but I got to think that it really doesn't matter which end you start from, as long as you start from one end or the other. Okay, so let's start at our pinky. Our pinky for this one, which is a little different for me because I never actually started my pinky. All right, inside, bring it around. Backside, over the top, inside, just like I like it, nice and sudsy. I don't know if any people out there is weird like that, like me. Don't like a lot of suds on their soap. It's definitely me. Feel like it's clean or something. And because I'm super used to this, I don't really feel a burn, but you will feel a burn in your biceps if you're not used to performing these surgical scrubs on a daily basis. Okay, bring this around. But that's okay though, a little burn is all right. A little workout of those muscles can't hurt a little bit, tone you up, you know. All right, so I'm at the other end. Look at that. That felt super weird because I never started my pinky. All right. Back of the hand. Down to the wrist area. Side, side, side. You also want to be down, okay, side. You also want to be super careful not to hit this faucet with your arm as you're scrubbing. All right, I'm all done here. After you're done at this point, you take your brush, discard it, water back on, and you begin to rinse your hands. Now, for this part, it's perfectly acceptable to kind of just take your time. Make sure you get all those suds off. I like to try to get it off in one pass if I can. That way I ain't wasting too much time at the sink. Because, you know, once the patient is done prepping, it's go, 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 go. So, you don't waste too much time at the sink if you can help it. Shake the access a little bit. And then I do my second arm. All right, take my time, bringing it through, not hitting anything, keeping good technique, my elbow lower than my fingers, making sure everything runs from clean to dirty. All right, I'm gonna do one more time, good measure. All right, it's all done here at this point. You want to keep shaking that excess off so you can get as much of the water off as you can. And turn your water off and you're all set to go down.